supporting Fort Bend, as well as what folks can do given the current situation. We just came out of a meeting with a range of partners where we've been exercising the scenarios we've been planning for. So we have had plans for months that we've been updating, going to what would we do if such or another scenario were to occur. And so what we did today was run through those different scenarios with our partners, from our healthcare and public health departments to our engineering department, human resources, the different City of Houston departments, the network of hospitals, different folks who would become key players in the event of a response or the need to ensure continuity of government operations.
So we'll be getting the results of tests. We're going to be telling folks in about 24 hours, and the reason we run it takes hours to run the test. And so we'll start with the batch that we have in the morning. By the end of that day, we'll have the results, and during that same time, we'll be taking in samples throughout the community that would be run the following day. So it's going to be about a 24-hour turnaround. And that will continue to be the case up until our lab has more samples coming in than we can run in a day. And so it's really important that the public understand that we will need to prioritize that. So, for example, people who are seriously ill and in a hospital and the doctors can't find another reason for their illness, in addition, we will be doing tests that the test has to be ordered by a practitioner, by a doctor or a practitioner. So you won't be able to just come up to the lab and say you want to be tested. There has to be a reason for you to be tested. And I'm counting on our medical professionals in the community to not submit tests for people who have no risk factor, no symptoms, no reason to be tested other than they're simply concerned, because we have to maintain our testing capacity for the people who actually do have risk factors or who are acutely ill. We are, as Dr. Shaw described, we are getting in touch with those folks and trying to make sure that we minimize, if not eliminate, their movement within the community. In an ideal case, they will stay at home in their bedroom.
It's provided to bring all of us together as partners here, both from a health standpoint, but actually more importantly from all of county government and our partners at the City of Houston and other regional partners, including in the private sector. Dr. Peirce and I were yesterday, as the judge mentioned, in Fort Bend County supporting our partner colleague at Fort Bend County, Dr. Minter, and we are really, this is, I think, the key message we want to make sure everybody knows is that government is doing everything it can, not just within county government or city government, but across this region, that the elected officials, policymakers are connected, but so are the public health departments. First is that we do not confirm, and their judge has already made this comment, but I do want to make sure to emphasize it. We do not confirm rumors and myths. What we confirm are actual test result positive.